Okay. Thank you for joining us and welcome to the South Sudanese Women Intellectuals Forum. My name is Dr. Anne Lombole and I will be the moderator for this session today. Today on our special edition, we'll be discussing sickle cell anemia. We will discuss the myths associated with it, facts, and we are also honored to have someone on the panel who will give us a personal perspective. Sickle cell disease is one of the most common inherited disorders of hemoglobin. This is the part of the blood that carries oxygen. In Africa, it is one of the most common inherited disorders and is the most common inherited disease known to cause death in children under 5 in Africa. The sickle cell trait, on the other hand, is the benign form of sickle cell disease where only one part of the hemoglobin is affected. Individuals with sickle cell anemia manifest a lot of complications, including painful crisis, hemolytic crisis where the blood cells break down, sequestration crisis where the blood cells collect together and block the veins, and also this can lead to stroke and it can lead to severe anemia and even death. Those with the trait are mostly asymptomatic unless they are exposed to conditions that can trigger a crisis. Now, sickle cell disease has caused untold suffering in those who are affected, and stigma is also very prevalent and is perpetrated by lack of understanding and knowledge about sickle cell disease. In South Sudan, there is scarcity of data regarding the occurrence of sickle cell anemia or the trait. One study that I came across was done in Juba Teaching Hospital, and what it showed was that there was a prevalence of about 9% of individuals with sickle cell disease. 11.6% of those were male, and 2.5% of this were female. This shows a high prevalence, and the high prevalence of sickle cell anemia in most of the countries where it is found is due to the fact that most of those countries are malaria endemic zones. It is believed that the sickle cell gene came about because the body wanted to protect itself from severe malaria infections. So those with the trait are protected. However, those who end up with sickle cell disease then suffer all the crises that I've mentioned and still get malaria infections. In South Sudan, there is a need to still do systematic epidemiological studies to assess the prevalence rates of sickle cell disease and sickle cell trait in the different areas of our country. This study indicates, therefore, the need for massive awareness to improve the understanding of sickle cell disease and the management of those with the disease or the trait. Screening programs should also be established, and in the West, they actually do screening at birth, and this screening will enable individuals to know their sickle cell status, which will enable early intervention and prevention of subsequent complications. There is also need to improve the services for individuals with sickle cell disease in order to ensure that they are offered appropriate management and in time. For our discussion today, we are joined by two esteemed guests. At the moment, one of our guests is trying to log in, but we will have him on the screen as soon as we can. But first, I would like to introduce our guest who is currently on the screen, Ms. Suzanne Gimirigo Juma, who will be giving us a personal perspective. Ms. Suzanne is a champion for advocating for the reduction of stigma against individuals who suffer from sickle cell anemia, and she has also been very vocal in educating the public in sickle cell anemia and its effects. Ms. Suzanne, we are very grateful to have you join us today. Welcome to the South Sudanese Women Intellectuals Forum, and thank you for agreeing to participate and give us a personal perspective on sickle cell anemia. Now, our other guest who will be coming on the screen once we sort out the technical issues is Dr. Joseph Gore Elias, who is a pediatrician with an undergraduate degree in medicine from the University of Juba and a Master of Science in Pediatrics from Cairo University. Dr. Joseph is currently undertaking a fellowship in pediatric hemato-oncology at Makerere University in Uganda, and he is the right person to actually speak to us about sickle cell anemia. On completion, he is going to be one of the first South Sudanese pediatric hemato-oncologists. He will be discussing the medical aspects of sickle cell anemia, including the definitions, statistics, and treatment. In case we are unable to get him on the screen, we will definitely hold a session where he will be able to discuss the medical aspects of it. But we will go straight ahead to starting the discussion with Ms. Suzanne. We'd like to thank the audience for joining us, and we hope you can stay with us throughout this discussion. Please feel free to ask any questions on our comment section on the South Sudanese Women Intellectuals Forum page, and we will try to answer as many of the questions that we can. Our technical people will be picking up the questions from the audience, and then we will forward them to the panelists as appropriate. So I'll go straight to you, Ms. Suzanne. Maybe you can do just a brief 2-minute introduction about yourself before we go straight into the discussion. Ms. Suzanne, welcome.
Thank you. Hi, everyone. My name is Suzanne Bujuma. I'm 28 years old, and I'm a sickle cell warrior. Thank you very much for this
Thank you so much,
session.
Suzanne.
I appreciate.
Thank you so much, Ms. Suzanne. It's good to have you here, and it's very encouraging that you're willing to speak out and talk about sickle cell anemia, because it's very difficult to find people to actually talk about something that they themselves have experienced. But I think it's very important because we are able to sort of put ourselves in your shoes and be able to see from your perspective what actually goes on with this condition. So, Susan, when was it that you were told, or when was it discovered that you have sickle cell anemia? I know it's usually discovered when you're quite young. Tell us about that.
Actually, I cannot tell the time frame that it was diagnosed, because I think it was diagnosed when I was still a child. But my doctors and my mom came to tell me about my condition when I was about 10 years old. That's when I started to understand what I was passing through. And my doctors used to tell me that I was normal, and yet to me, I thought I wasn't normal. So before I could understand that it was a disease, everybody, it was not really something that I could bear, because I didn't know what I was going through until when I reached 18. That's when I came to embrace that I had sickle cell anemia. I came to learn about it and understood what I was going through.
Thank you so much for that, Susan. Just to just expand a little bit, before you turned 10 and your mother and your aunt were able to explain to you what was going on, what was it that used to happen to you that you felt was different from what other children were experiencing, to make you think or see that there's something actually going on with you that is out of the ordinary? What were the things you were experiencing?
Okay, most of the time I was always rushed to the hospitals. Then I couldn't play like normal kids. When I would play too much, I get severe headache, severe joint pains, and severe chest pain that I didn't understand what was all that pain. And also, all the time I could run out of blood. I was anemic throughout. So, like, it wasn't like my childhood really was a struggle, because when normal kids are playing, I'll be in school like maybe for 2 weeks. The rest of the week, I am admitted at the hospital, and I'm always under medication. I will be told to take medication all the time, So I was wondering, I would ask myself, why isn't my brother or my sister taking the medication like me? And I'll be placed under special diet, like food. I had to eat a lot of blood boosters, like you have to have medication throughout. And I wouldn't understand really why the pain was always coming towards me, and I would I'm just normal playing, then I just collapse. In school, most of the people used to call me the epileptic girl. I would collapse, go blank, and everybody rushing to me, and nobody wants to play with me. So it was really difficult. My childhood was really a struggle.
Thank you so much, Susan, for that. Well, it's quite sad that it was so difficult for you, especially in your childhood, because you really didn't understand what was going on. And I think
When
that,
really you don't understand
mm,
what you're going through,
yeah,
you would think that
and
maybe
usually,
everybody is
mhm,
against you, because
yeah.
I would have doctors. You are every week you have to go for treatment.
For that, well, oh, sorry about that. Yes. So I understand that actually it can be very difficult, especially as a child, to understand what is going on, especially when you see that other children your age are able to play without any problems. They're not restricted in terms of their activities, they're not restricted in terms of their diet, and no one is actually telling you what it is. So when your mother and your auntie broke it down to you, what were the words that they used when they were explaining to you what has been going on with you since you were young? What are the words that they used to break the news to you?
Okay, my mom would always tell me that, Susan, you are normal, but not like the other children. And
Mm-hmm.
she'll tell me that you have a condition that makes you special among my children.
Mm-hmm.
So I asked her, like, Ma, what do you mean?
Mm-hmm.
She told me that it is just a disease that you have, a condition that makes you special among
Mm-hmm.
other children. And when I was taken to my doctor in MPSHA, Dr.
Mm-hmm.
Khan in MPSHA, he sat me
Mm-hmm.
down and he told me that your condition is not it's not that bad. Yes, like maybe he was just trying to make me feel good, like they are trying to make you feel like you're just there normal. But it's just a he told me that it's a condition you can fight. It is
Mm-hmm.
just a condition that you can rise above it if
Mm-hmm.
only you do as I tell you. So for my mom, it was pretty difficult because most of the time, children with sickle cell, they're said to die at an early age. And most they say that they can't reach 18 years. But she told me, my daughter, you will go as long as God wants you to live. It's not upon our hands to say when you will die, but all you have to do is pray to God all the time and take your medication as prescribed by your physician.
Thank you so much for that, Susan. Quite a very in-depth explanation there of how your mom told you about what was happening with you. And I think I like your mom's approach. Really, it is even quite difficult for even medical professionals to give this information, whether to the person who's affected or the family who has to take care of someone who's affected. And I think your mom did quite a great job, and even the doctor did quite a great job explaining to you that there was a way to actually manage your condition. And yes, for a long time, people would actually say that it was very rare for individuals to live beyond 18 years. Maybe you can clarify for us, Susan. How old are you now?
Right now I'm 28.
28.
I
Yeah.
am, yeah,
Amazing. So you are a great testimony of what can be
yes,
done when children are actually taken care of adequately from when they're young, to prevent the complications that are associated with sickle cell anemia and sickle cell disease. And I think I
yeah,
give the props to your mother, and I give the props to the doctor who was able to follow you up. And yes, there are individuals, actually a doctor who at the moment is in his 60s, who has sickle cell anemia.
yeah,
So the reason why they would say at that time that most children didn't live beyond 18 years of age was because management was an issue, taking of medications was an issue, and the follow-up initially was not as good as it is right now. And I think you are a beacon of hope for anyone who may be going through the same thing. So, are there any
yeah.
specific experiences that you look back on after you were able to understand what was going on with you, that maybe it changed the way you looked at life and the way you looked at the illness that you are suffering from? Is there a specific experience that you can tell us about that really changed your perspective when it comes to sickle cell disease?
Uh, yes, there is when I was in Form 2 in my high school life, there was a teacher, my literature teacher. I collapsed in school, and everybody rushed to me, and they were like, so like when I woke up, everyone was like, she has collapsed. The epileptic girl, she has collapsed. So when I woke up, everyone was looking at me and like, this is not normal, because I got into really serious crisis. And the teacher came to me. He told me, you know what? You can rise above anything that you're going through in life. And for you to do that, you need to talk out. Because not once, not twice, I thought of suicidal moments. I thought that I should just end my life. Wasn't worth living. I had a very low self esteem, and I had a very hot temper. The anger inside me, because I thought that even my mom, everybody was against me, because I can't do anything that that any child should do. I can't play. So I was like, do they think I am mad that I have to go to a psychiatrist? I have to go to a psychologist to like have sessions with him. So I thought it was better to die than live and see my rest of my life that I'm just suffering and suffering. There is nothing else I can do. So the teacher told me that what you can do is, do you know the big man above? So I asked him, which big man? He told me there is God in heaven. What you can do is alone, surrounded by nobody. It is just you. So, and just to place yourself like that, like you don't have parents, nobody, it is just you. And look above and ask God to give you that courage you need. Rise above your low self esteem. Stop thinking about suicide. Stop thinking about anything negative, because the more you think about it, the more you will suffer. The condition is there, yes, and you cannot blame your parents for that, and you cannot blame God either. So from that moment, I started visiting hospitals. Uh, I started visiting hospitals. I saw a child that was abandoned in Kenyatta Hospital. He was a sickle cell. His mom abandoned him. He was just 3 years old. So I asked the nurse what was wrong with the kid. So she told me that the baby has sickle cell and the mom thinks he will die very early. Then I stood there, I asked God. Then I am very lucky because my parents are there for me. My brother is there, and I have survived that time. So I have to be grateful. So I grabbed the opportunity and I told God, I am not going to cry again about my condition. I am not going to feel pity about my life. I am going to campaign and talk about this disease that people think that it is something that is just from birth to graveyard, you know. Like you see your life, you just born, then you die. You have nothing, you have no purpose in life. So
Mm,
that's how I got the courage to speak about
mm.
sickle cell. And back then, I think right now, I wouldn't do what I did before. Yeah.
Wow, that's an amazing testimony, Susan. And I think some of the pointers that you have indicated are the importance of family support when it comes to conditions that are chronic, like sickle cell disease, and the importance of having an understanding community who are aware of what the illness means and what happens to those who are affected by it. I think also, yes, you've talked a little bit about at some point you felt that life was very difficult and you felt like it was not worth living, and seeing someone else in the same condition who probably also didn't have the kind of support you got from your family made you realize that life is actually worth living. And I think for children like the one you saw at the Kenyatta National Hospital, having someone like you out there who's talking about the disease and talking about the way you have been able to survive to this age, despite all the crisis, despite all the obstacles, I think it's important because it's giving people out there hope. And thank you so much for agreeing to speak on this issue. Now, the other question I would like to ask you is, what are some of the myths and misconceptions about sickle cell anemia that either you have experienced or been subjected to, or that you have had, and what do you think can be done to get rid of these myths and misconceptions?
Most of the common myths of sickle cell anemia that I have really experienced was that when you tell someone, when a kid is discovered that they have sickle cell, automatically someone say, this one cannot live, this one cannot survive. I don't really have time that sickle cell anemias, they don't survive. That's the most common one that I have even experienced. When I tell someone that I have sickle cell, they look at me and say, "Hey, and you're this happy. You should be sad because sickle cell anemic children don't survive. You have few years to live, you know." And another one, people think that, especially when it comes to a spouse, when you tell them you have sickle cell, they automatically think that sickle cell is transmitted like HIV/AIDS or like tuberculosis. So that's what they think mostly. And also, when you go to apply for a job, that one really has affected me a lot because I cannot get a good job out there. When I go to apply for a job, I'm told that if you have this condition, then you cannot work with us. You cannot get a job with us. job with us because you're just like a liability. You will be sick all the time. So we really don't have any vacancies for you. So what I think is that, like the way the people have put it out there that HIV and AIDS people can go and test for free, I think they should do that in the hospitals before couples get before couples get married, they should go for genotype test, for them to know their genotype and know if one is a sickler or they are carriers, something like that. I think the hospitals and the community at large, the way they talk about HIV, AIDS, cancer, diabetes, all those diseases, I think sickle cell anemia should also be included in that. It should be free awareness about it because people are really ignorant about sickle cell anemia, and most of them are scared even to talk about it outside there. Because when you talk about sickle cell, people feel pity for you, they feel sorry for you, they think you're just a dead walking corpse, you're just there, you live by the grace of God, you have no, like you cannot move beyond your condition like that. And the medication really, from the medication, sometimes the common man cannot afford it. Sickle cell anemia medication is very expensive. The medication itself, like a folic acid, for you to maintain that folic acid, you have to take it every day. There are people who live on hydroxyurea. Hydroxyurea here in Kenya, you have to get it for around 5,000. That's around $50. There are people who cannot afford that. There are people who have serious sickle cell has made them to have serious conditions. Like for me, my eyes have problems because of sickle cell. You have to use glasses, because it can lead to blindness if you have a continuous crisis. They cannot afford those glasses. So my urge to the community or to our people is that more awareness about sickle cell, the way they have done with the other diseases, it will really help a lot. And it will really, at least, reduce the death rates of sickle cell people and sickle cell children.
Thank you so much, Susan, for giving us an account of what some of the myths and misconception are about sickle cell disease. I think it's quite unfortunate that employers would think that you are unemployable because of sickle cell disease. At this day and age, where an individual can actually get medication to control their crisis, it is actually against labor law for that to happen. And however, as you said before, it's very important for there to be a lot of advocacy and a lot of education on sickle cell anemia to ensure that that kind of stigma and discrimination becomes a thing of the past. Now, you talked a little bit about genetic counseling. I would call it genetic counseling because that's what it is, where you have indicated that when it comes to marriage, that individuals who have sickle cell disease, or who have the trait, those are individuals who have only one of the hemoglobins having an issue, should actually go for genetic testing and counseling, and so that their partner is also checked to see whether they have the trait or they have sickle cell disease. And the importance of this is so that the individual is advised that, especially for those who end up with partners who have the trait or sickle cell disease, then you're able to be told what the probability of your children having the disease are. And this is very important for anyone who either has the trait or either has sickle cell disease. And I'm very happy that you talked about that. And now when it comes to testing, I know that in Africa, we usually test much later after the child has started developing symptoms, and most of the children start being picked up at around 6 months of age. This is way, way, way after they're born. And yet out there in the Western world, they're actually able to do the test at birth. And this is something that as people, both as advocates for the health, uh, for healthcare and advocates for knowledge on sickle cell disease, this is something that we should actually push for, where people are actually tested at birth so that it's identified early, and knowledge is given and information is given, and the correct treatment and interventions are done. Now, you talked a little bit
Yes.
also about the fact that the drugs are actually very expensive, and you're right. Um, People who have sickle cell disease have to be on certain medication for almost daily, actually weekly. And the reason for this is because they have to keep boosting their blood formation, because they're always breaking down cells when they're in crisis, and that's the reason for the folic acid. And they also have to boost the formation of a different type of hemoglobin, what we call the fetal hemoglobin, using the hydroxyurea. And when that fetal hemoglobin is higher in the blood, then it helps to prevent the frequency of crisis. And $50 is quite a lot. And therefore, for many, many, many people who suffer from sickle cell disease, this is something that is not affordable. And we should advocate for healthcare being made affordable and accessible for individuals who suffer from sickle cell disease. Now, apart from the challenges that you have mentioned, the misconceptions people have, the discrimination and the stigma, and the expenses that come with the care for sickle cell anemia, what are some of the other challenges that maybe you have not mentioned that you would like to inform the audience who are listening to you, to be able to just get a glean into what exactly goes on when someone has sickle cell disease? Susan, what are some of the
Okay.
challenges that maybe you haven't mentioned?
Some of the challenges that I haven't mentioned are that the hospitals, there are some places when you get a crisis. I once went to a place where around Kitui, around here in Nairobi. I went there, but then we couldn't get nearby hospitals. And most of the hospitals, some of the rural hospitals, do not have those equipments or medications for sickle cell anemia. And this is really a challenge because someone can go with the crisis to the hospital. If you cannot, you don't have, if you don't, they don't have the medication, it can end up for you die. And if doctors are not aware of your condition, they will just treat you for the common diseases. Like for me, I've been once treated for epilepsy, thinking that I was epileptic, you know. Some medical doctors really, they even have to know about this disease. The hospitals need to know that this disease exists. And also on feeding food, there are common people outside there who cannot afford food. A sickle cell person is supposed to be on a regular, healthy diet. You have to eat throughout. You don't have to be hungry. You have to eat at least 4 to 3 times a day. Like you have to eat a healthy meal. You have to get adequate food, enough water. There are places we don't have water. They don't have water supplies. They don't have those medication. They know nothing about it. And this is really a challenge. Even if they cannot go everywhere, but with the campaign, we have the social media. We have radio stations and TV. I've never really for sure seen anyone campaign about sickle cell anemia. So it means that most people are not aware about sickle cell anemia. Most of the people do not know what is sickle cell anemia. And those people who cannot afford that food, they end up having more crisis, and actually the kids die very early. And also parents should not ignore any sign of sickle cell anemia in a child. Like you hear a child complaining of constant weakness, constant joint pains, severe headaches. They'll give you Panadol. And once you take that Panadol, a sickler, you're not supposed to have medication over the counter unless prescribed by the doctor. So that's really a big challenge. We need that campaign. We need people to speak out about the sickle cell. They shouldn't fear to speak about it. It is something that is there. It is something that is killing. It is more even deadly than HIV/AIDS. HIV, people are given drugs for free. There are people who get ARVs for free in the hospitals. They get tested for free in the hospitals. Why can that be for sickle cell people? They get at least, even if those taxes on the medication to reduce, you know. Right now, I have a girl, she's around 11 years old, and she's been in hospital in Baghdadi. Some of the girls that I normally visit, she's being in. Her mother do not know what type of she has until I told her to ask the doctor to explain to her the type of sickle cell she has, because she's been going under blood transfusion like for the past 3 weeks now. The doctor is telling her that she has sickle cell, but she don't know the type of sickle cell. On top of it, the bills keep going high. The medication is not there. They write for her, go buy the medication at the chemist, because they don't have it in the hospital. How will she afford? She lives in the slums. She's a single mother, a single parent. This is really a big challenge for this
Yeah.
disease, even if at a small fee, living with sickle cell anemia.
Yeah. Oh, thank you, Susan. I think now what you have actually uh, been able to tell us is that even as health professionals, we need to be very aware of what goes on with sickle cell disease. We should be the ones out there advocating for better care, advocating for affordable medications. Now, I have Dr. Joseph on the line. We're going to try and see whether we can hear him when he speaks. So we will see. So, Dr. Joseph, I don't know if you can hear me clearly. Dr. Joseph?
Hello? How are
Yes.
you?
Can you hear me clearly?
Can hear you now.
Um, um, we'll just get feedback from the audience in a bit whether they can hear you. But we won't. You can just put off the video call, then we can do audio.
Okay.
Thank you. So it's more clear there. So, Dr. Joseph, if you can tell us what is sickle cell anemia, and is sickle cell anemia common in South Sudan, and are you aware of any statistics and how they compare to the rest of Africa?
Okay. First of all, let me just apologize for the audience for the inconvenience because of the internet. In brief, sickle cell anemia is a disorder of the blood. It's due to inheritance of abnormal gene from the parents. That means to have sickle cell anemia, you have to get an abnormal gene, one from each parent, that means one from the mother, and then another one from the father. There's also another important condition when you are talking about sickle cell anemia. We have something called sickle cell triad, and then we have something called sickle cell disease. Sickle cell triad is the same like sickle anemia, but the difference is in sickle cell triad, you inherit only one gene. But if it's sickle cell anemia, you inherit two genes, one from each parent. And then when we talk about sickle cell disease, it is a disease like sickle cell anemia, but it's not sickle cell anemia. That means some patients will inherit two different genes from the parents. Like for instance, we have something called sickle cell C. That means the patient will inherit one gene with sickle cell gene from one parent, and then another abnormal hemoglobin called hemoglobin S. This also we call it sickle cell disease. As examples, we have so many examples like sickle cell E, sickle cell beta thalassemia, and then sickle cell E and sickle cell O. All of them call them sickle cell disease. That means sickle cell anemia is one part of the sickle cell disease. And then sickle cell triad is a form of sickle cell anemia, but in that form, the patient inherited only one gene from the parent, not two genes like sickle cell anemia. Usually, sickle cell disease, the usual manifestation of sickle cell disease is designed like a chronic anemia. Anemia means low hemoglobin in the blood. Again, sickle cell anemia is one of the common cause of chronic anemia. And also another manifestation, we have pain in some part of the body, and sometimes the present is stroke, and a lot of other presentations. When we talk about whether sickle cell anemia is common in South Sudan or not, it is there because I've been working in South Sudan and I've been treating so many cases of sickle cell anemia. But unfortunately, up to now, we don't know the total number of cases in South Sudan. I think this is another problem. I think this is another issue for us, say the pediatricians. We have to do some research so that we know the total number, the prevalence of sickle cell anemia in South Sudan. Regarding whether it is common in Africa or not, sickle cell anemia is very common in Africa. In the literature, they are saying that 50% of all cases of sickle cell anemia in the world is in Africa, especially in Nigeria, Cameroon, and then India. That means you have like 100 cases of sickle cell anemia in the world. 50 of these cases will be in these different countries. It's in Nigeria, and then Congo, and then India. Even in the neighboring like Uganda, where I'm working now, there is so many cases of sickle cell anemia. Roughly in a day, you can just see we have a clinic specialized for sickle cell anemia. In a day, we used to see like 50 to 100 cases of sickle cell anemia. That means if you multiply this by 30 days in a month roughly we see like let's say 1,500, 300 to 3,000 in a month. That means sickle cell anemia is very common in Africa. For South Sudan, up to now we don't know, but we used to have some cases there in South Sudan. This is brief what I can say about your questions.
Thank you so much, Dr. Joseph. You had mentioned just a few of some of the signs, and you had mentioned some of the signs and symptoms of sickle cell anemia. Why don't you just give us a brief overview again and tell us a little about what some of the treatment or management strategies for sickle cell anemia are, and what are some of the challenges in management in South Sudan or in general?
Okay, regarding the symptoms and signs of sickle anemia, as I mentioned earlier, it's common to present with anemia. That means low level of hemoglobin. But there's also presentations. For instance, like all common crises in sickle cell anemia, but one of the crises are presentations. One of the presentations means that the patient will present with low hemoglobin level. That means when you do you will find that the hemoglobin level is very low. It's one of the presentations of sickle cell anemia. Another presentations, they will present with these painful episodes. For instance, they will come to present pain in the limbs, sometimes pain in the abdomen, even sometimes just present with stroke because of that one. That means painful episode in any part of the body can just be a presentation of sickle cell anemia. Another also common presentation of sickle cell anemia is something called sequestration crisis. That means some of the patients, for one reason or another, the blood in their body will just be pooled in the liver and it's. That means they just come to you with signs of anemia. That means there will be a sign of anemia plus enlargement of the liver and spleen. It is also very common for sickle anemia. Another presentation also they can just present with aplastic crisis. That means when you just deal with infections, sometimes with bleeding due to low blood cells, like the hemoglobin will be low, even the subsequent infection will be low. That's why infection and then also the blood cell that's responsible for the blood will be very low, and then that means reliable to they will be just exposed to this low platelet count. Regarding the management of sickle cell anemia, it usually depends on the presentation of the disease. For instance, if they deal with anemia, that means low hemoglobin. In that case, if it is symptomatic anemia, that means the child will be weak, tired, and then having fast feeding. In that case, the management is to give because now the blood is very low, then it manifests as what I have mentioned. Another thing to management, if the patient presents with painful episodes, like pain in the limbs or in the abdomen or the chest or stroke, the most important thing you have to give painkillers. The common painkillers that we use in case of sickle anemia, we use the Panadol. Sometimes we use also Brufen, and other times if the pain is very severe, we also add morphine or opiates. Sometimes when it's severe, also you need to give fluid. Even some instances, you have to give also blood so that you relieve the pain. And then in case of sequestration, the other presentation, that means pooling of the blood in the liver and spleen. In that case, you have to also give blood as management. When you give blood, the blood that pool inside the liver and spleen will come out, and then the child will be out. Also, in case of severe chest pain, for that presentation with acute chest syndrome, that means the child will be having severe chest pain, and they will be having fast breathing. Sometimes even when you check the oxygen saturation will be low, will be having cough. In a facility that you can just do a chest X-ray, you'll find some evidence of the X-ray. We call it new infiltrate. That is very severe part. Patient, give them blood. Sometimes you give them oxygen, fluid, plus painkillers. Also the same like if a patient comes with stroke, you also have to give blood, sometimes fluid, and sometimes oxygen. Regarding the challenges in the management in South Sudan, we have so many challenges. Number one, up to now, we don't know the total number of cases, which is not good. Other thing, we don't have a centralized place or a center where we can just manage these patients. And then these patients are supposed to be managed by specialists in blood diseases, so that they can just give them the best management for them. And also, if you have a sickle cell patient that comes to you with severe complication like acute chest syndrome, where you need to give them blood, sometimes it will be a challenge because most of our hospitals we don't have oxygen, especially central oxygen. That is will be the use for this patient is very not there. And then I have mentioned earlier that one of the line of management for sickle cell anemia in cases of crisis like in acute chest syndrome or in case of stroke, you have also to give blood. And you all know that in some you have a challenges with blood. Most of our people they don't then and sometimes it's going to be difficult to get even blood to give to those sicklers. I think this is some of the challenges that we are facing in some management of sickle cell anemia.
Thank you so much, Dr. Joseph. I think you basically indicated that for us to be able to manage sickle cell anemia or any condition, chronic condition in general, we need to actually build our healthcare system, because even if we do have specialists who can manage sickle cell anemia and the crisis, if we don't have an oxygen plant, it becomes a problem. If we don't have people donating blood, it becomes a problem. So the health system actually has to work for all illnesses to be treated adequately. Now, my other panelist, Ms. Suzanne, talked a little bit about marriage and when it comes to sicklers and having children. Can you tell us a bit about what genetic counseling is and why it is important in sickle cell anemia?
Yeah, I think this is a very important point because as I mentioned, to get sickle cell anemia, you have to get two abnormal genes from your parents. That means one gene from your mother, another one gene from your father, so that you will be sickle cell anemia. This is the severe form that I just mentioned. I think we can just prevent, even sometimes you can just, by counseling, you can also prevent some people to get sickle cell anemia. That's why they say, especially for people who are just planning for marriage, it's usually advisable for them to go for test, especially before they go for marriage. Because, for instance, if I'm one of the patients having sickle cell disease, and then I'm with another lady with sickle cell trait or sickle cell disease, that means the likelihood of some of these of their kids to have a sickle cell is very high. Which usually they say 1 to 10%. That means in 4 kids, only one will be affected, and then like other one also will carrier. That's why we advise all people who are just planning for marriage, let them just go for testing. So that if they are both carrier, I think we can just cancel them. That means that the possibility of having kids with sickle cell will be very high. If it is possible, let them look for another partner if possible. This is the importance of getting counseling. Sometimes even if they decide to go ahead with the marriage, if they are planning to have kids, especially when when the wife get pregnant, like other countries they can also do testing so that they know the genes of that baby inside the uterus. If it's having sickle cell anemia, in other countries they allow they just give them chance to do abortions in other countries. That's also another very important for counseling and all these things. Over to you.
Thank you so much, Dr. Joseph. Please stay on the line. I will ask Suzanne a few questions and then I'll get back to you, and you will be able to tell us what some of the long-term health and social and psychological complications of sickle cell anemia are. So please stay on the line, Dr. Joseph. The next question I would like to ask goes to Miss Suzanne. Just I know you've had quite an experience, living with sickle cell anemia, and even in the beginning, not even really knowing what was going on. So, if you were to speak to the community and to healthcare professionals, what would you wish the community knew about sickle cell anemia, and what would you tell them? And what would you tell healthcare professionals to do that would improve the care of people with sickle cell anemia? Susan.
Well, what I can say is that People should know that sickle cell is real. It's real and it's dangerous. First of all, sickle cell is an expensive disease to maintain. And from what I can say is that from our like the health professionals, they should really provide, like the doctor said, make good care. The hospitals, like the hospital should have those equipments. Mostly when we get crisis, we are put in the ER for sometimes just to be watched and to be seen. In that, we need the medicine. We need the oxygen. Our health our health facilities should have those equipments, and also the community should not have a stigmatized with sickle cell anemia. The same way they have learned to embrace people with HIV, with cancer, they should also learn to embrace us. We are warriors, so we are fighting unseen disease. We don't know what we are fighting, but we have to fight anyway because this is life. Unseen disease that many do not know about. And just as the doctor said, people should really go for the genotype test in the hospitals. That's the first thing actually couples should do, because you really don't want to bring out a child to this world for the child to just suffer and die. And it's nobody's wish to have sickle cell, really. They shouldn't put it upon us like sometimes you hear people say, that's pretending. You cannot pretend with pain. You cannot. When you're down, when I say I am in pain, I am really in pain. I don't know if you can experience the pain like a saw cutting through your flesh, like someone pulling your flesh with a broken bottle. That pain is serious. And normal painkillers cannot pain down. You know, at one point, see a child that they want to go for we don't have those facilities in Africa mostly. They have to fly them. They, they have to fly them to India, and that's a lot of money. If our health facilities can have those things, those hospitals that do that bone marrow transplant, it will really help a lot. You see people raising like millions to fly to India, and on the way the child ends up dying because they cannot afford that amount. So if we have those bone marrow transplants done in Africa at a good, maybe a good fee, most children will not die. Also, love, love from the society, love from our own family. It has helped me grow. To who I am today, I owe it to God and to my family. Above all, prayer. No condition. For me, what I know is that there is nothing that God cannot do. He can keep you healthy no matter your condition. So from that, I would just say that.
Thank you, Suzanne. You're breaking up a little there. I think you've frozen a little. Thank you for that
The
overview.
parents, you don't need to give up. Don't give up on your child just because they are sicklers. They are not, don't see them like a walking corpse.
Thank you, Susan. Thank you for that. I think you've basically taken the words right out of my mouth, that the services should be provided and the stigma should end. And the only way that happens is through educating the public. We'll go a little back to Dr. Joseph. Dr. Joseph, we're back to you. Suzanne has talked a little bit about bone marrow transplant. Why don't you tell us a little bit about that, and then maybe tell us what some of the long-term health, social, and psychological complications of sickle cell anemia are, and how this can be prevented. Dr. Joseph.
It's okay. Thank you very much, Anne. Let me start with the bone marrow transplantations. But before we start, let me start with complication, then I'll talk lastly about the bone marrow transplantation. About the complication of sickle cell anemia, there are so many. It can affect any organ in their bodies. Let me start with the acute one, and then later on I will talk about the chronic complication. Regarding the acute one, I think it's the same like the presentations. They will just present with low hemoglobin, anemia, chronic anemia, pain, also the complication. Also, some of them will develop a stroke. This is the acute complication. Then when we talk about the chronic complications, it can affect any organ in the body because the pathopathy, but the mechanism how this sickle cell affects our body. Because of the abnormal gene, the shape of the RBCs which carries hemoglobin will be different. It will be like a sickle shape. That means half moon shape or C shape. And then when it becomes sickle, it becomes like that shape. It can be easily just stick together, working the blood cell supply to many different organs in our body. That's why they.
Sorry, Dr. Joseph? Okay. I think we've lost Dr. Joseph a little bit there. We'll try and get him back. So he's trying to reconnect at the moment. So, sorry, there he is again. Yes, Dr. Joseph, we lost you for a bit. Please go ahead.
Hello?
Yes.
Okay. The long-term complication because of the abnormal shape of the RBCs affect any organ in the body. What I've been saying that one. Let me start from up down. Because of that, it will just block the blood going to the brain. That will cause stroke. That means weakness of either one part, two part, or all the parts of the body will be weak. Another complications, long-term complications or chronic complications, also it affect the vision. It's because it causes something called retinopathy, which that means it affects the retina, which is the part responsible for visions. That's also chronic long-term complications. Some of them, because of this sickling, they will have also enlargement of the tonsil and adenoid. This is inside our airways, and this one will lead to blockage of the airway, especially during sleep. We call it apnea. And then we have something with the breathing. This is also another complication of sickle cell anemia. Then as comes heart.
Sorry, Dr. Joseph. Seems to be coming on and off. I think it has to do with us trying to actually have him on the phone. As he tries to come back on, Suzanne.
Yes.
Dr. Joseph?
Hello?
Yes, I had lost you a bit there. You were talking about the complications that lead to stroke. Please go on. Yes.
The stroke, it affects also the eye. It can cause something called, that means difficulty in breathing, especially when the child is sleeping. You call it apnea. It's another complication. Because of the anemia, chronic anemia, this will affect the heart, causing heart failure. Even the lungs can be affected by causing pulmonary hypertension. Even the gallbladder and the liver also will be affected. Even the kidneys will be affected. Also, we'll have also affection of the bones, especially the hip bone, because of the repeated infection, that's called vascular necrosis. That means there will be difficulty moving that limb. Is also another complication. Another complication also, some of them develop chronic ulcers because the blood supply is in the skin, because the blood is not going there, they will have ulcers, and ulcer will be chronic. Will be there for more than 6 months. So another complication. And so many other complications. And some of them, we have also complications related to the treatment, like the blood we are giving for some cases. Blood also have other complications due to this blood, like some infections, like
Okay, I'm going to try and call Dr. Joseph a little later, in a bit. So Susan, we can go back to you a bit, and my other question for you is, if you were to talk to other individuals who are going through the same thing, who are really suffering right now because of the complications and the effects of sickle cell anemia, what advice would you give them from your personal experience, and what are some of the fears you have about sickle cell anemia?
From my experience, what I can say, those suffering from sickle cell anemia, is that one, be prayerful. Pray a lot. Be prayerful. Adhere to the doctor's prescription. Take your medication as required. And also, always go for your regular clinic checkups to know your HB levels. Every month, at least, do a test to know your HB levels. Always follow up with your doctor or the pediatrician to your baby to always know how your child is developing, because if you ignore that, the child may end up in serious crisis that may lead, as the doctor said, to stroke, heart failure, and so many disorders. And I would say that let them embrace the disease. It is already there. If a child is found with it, it is there. Accept the fact that you have sickle cell. Talk about it. Create awareness for those who have it, and for those who do not know anything about it. And don't put yourself there like, okay, I have sickle cell, I cannot do anything. Go out there, send yourself, you have a dream to achieve. It is not the end of the world. Sickle cell is just a normal disease. Take your medication on the healthy diet. And also, as I said before, be prayerful, be loving, and be kind. That's all I can say. To the community, kindly create awareness. To our medics, create more awareness. And also, we need the necessity, at least if the government can give some incentives on the medication for people, it will really help us. And we need really to eradicate the stigma that comes with sickle cell anemia from our people. Sickle cell is not malaria. Not treat sickle cell the way you treat malaria or epilepsy. Sickle cell is serious. It is there. We need to embrace it. We need to talk about it. We need to create more awareness about it.
Thank you so much, Suzanne, for that. And I hope those who are affected and the families who take care of individuals who have sickle cell anemia have listened to you and have taken your advice very seriously. And that as health professionals, we will push for educating the public, and push for better health services to ensure that people with sickle cell anemia are treated appropriately and in time, and that we will also try and advocate for cheaper medications so that even those who are unable to pay for what is expensive are able to access these medications. So, Dr. Joseph, back to you. We wanted you to tell us a little bit about bone marrow transplant, which is something that has been used to treat individuals with sickle cell disease. Tell us a little bit about it and maybe mention a few new therapies that have come up for the treatment of sickle cell disease before we try and close in a few minutes. Dr. Joseph?
Okay. Okay. Regarding the bone marrow stem cell transplantations, I think this is one of the mode of treatment that you use to treat patients with sickle cell anemia.
Mm.
It's one of the definitive treatment for sickle cell anemia. That means when you just give them the bone marrow transplantation, they will be free from there will be any sickle cell anemia for those patients. I think also this one, even it was discovered by chance.
Mm.
Why I'm saying that? Because it was discovered in 1982.
Mm-hmm.
I think it happened by chance. One of the sickle cell anemia patients had developed a cancer. That cancer is called acute myeloid leukemia.
Mm.
And then treatment for that cancer, one of the ways to treat that cancer is doing for them also bone marrow transplantations.
Mm-hmm.
I think that guy also undergone bone marrow transplantation, and then after the transplantation, they have discovered that even the sickle cell anemia disappeared.
Mm.
That's how they knew that a stem cell transplantation is also one of the mode treatment for sickle cell anemia. Yeah, it's a very good treatment for sicklers, but it's also very expensive and only done in specific places.
Mm.
Like in Africa, I think the only place in Africa that's doing bone marrow transplantation is South Africa, I think, and Egypt, if I'm not mistaken. Another place also they can just do this bone marrow transplantation is India and even America and Europe. They used to do such kind of thing. But also, because bone marrow transplantations, it's not an easy thing. You need to have an identical donor. That means they call it HLA. That means human leukocyte antigen identical donor. That means usually either your sibling or sometimes your parents. And then to have these identical parents, the identical donors is very difficult for some of the patients because they have just they have discovered that when they do transplantation using non-identical donors, the success of the bone marrow transplantation is very low. But if they are using identical donors, success rate for transplantation is now 90 and above. Is very good. And another problem with stem cells transplantation is the complication after that. They found in most of the patients, like 2 to 3 of these patients who are undergone bone marrow transplantation usually die. And then in 5 to 10% of patients, they use it to recover. They recur again. That means they'll have sickle cell anemia. And another also problem with stem cell transplantation or bone marrow transplantation is the medication that the child will be on after transplantations, which has also a very severe side effect. For instance, some of them, because of the drugs, can just develop infertility. As a result of that one, and even others, they develop cancers because of the drug. That's why they have a specific indication for those, especially those who have severe form of the sickle cell anemia. They are the one who are eligible to go for transplantations. They said also transplantation is usually for those having stroke or repeated stroke, those having severe form of chest syndrome, those who are having an organ failure, like as I mentioned, heart problem, and then kidney problem. This one you can just risk because also stem cells, as I mentioned, has also other complication of that one. That's why also they just do it for those who are really in need for that one. So, and then they have found that if you have like an organ affection like property, when they do for you the transplantation, usually you will, the organ affection will not proceed ahead. That means that's why it's very important for those, especially those having an organ and not an organ failure. That means affection. When you transplant them, that means the disease will not progress. Which is very important about that. For us here in Africa, I think we can just hide that because the transplantation in India I think is cheaper than other places. That's why most of the patients who need transplant, usually we refer them to India because there is cheaper. It's not that cheaper. I mean, I was told that the cost for transplantation in India is about $50,000 US, which is not a little money.
Not
that means you need to have. It's a lot of money.
Yeah.
50,000. Yeah. I think this is what I can just say about bone marrow transplantation in brief.
So it's a treatment that is given to those who have severe disease, and for those you want to save.
Not everyone, yeah.
Yes, and to save them from progressive end organ damage. And what you're also saying is that it's not available in Africa except maybe in South Africa, and it's quite an expensive treatment. And there are also side effects that come with the medications that are used to suppress the bone marrow post-transplant. And those are things that have to be put into consideration. Okay, Dr. Joseph, as we try and wind up the session, I just have 2 questions for you before we go to the conclusion and recommendations. What are some of the myths and misconceptions about sickle cell anemia in South Sudan that you have come across, and how do you think this can be dispelled? And what advice would you give to patients and those with family who are affected and the community on sickle cell anemia? Just 2 minutes, 3 minutes.
Yeah, in 2 minutes. Yes. Regarding the misconception about sickle cell anemia, in South Sudan, we have, I don't know what I say, because of the high level of literacy and all these things, some of the people there think that sickle cell anemia is something like a curse or is due to witchcraft or something like that. That's why most of the patients with sickle cell anemia, usually they have that stigma. Because as if they have done something wrong, that's why they have the disease. Which is completely wrong. Sickle cell anemia is just disease like any other disease like malaria or typhoid or anything. And then most of these patients, they are innocent. They don't have any contribution to have that. I think the only thing because they are unlucky, that's why they got the disease. And then to eradicate that, I think we need to do a lot of things, especially as health professional. We have to. I think this discussion is also one of the things we're supposed to do so that we eradicate this misbelief about sickle cell anemia. Then regarding the second question about recommendations, what will you say for these patients? I think I will say just a few things. The sickle cell anemia patients, they need to go for regular follow-up, especially with anyone, any doctor. Preferably if you have a pediatrician or somebody in your area, you can just go there so that they can identify complication early and then they manage them. And then very, very, very important for them, they have to make sure that, number one, they have the folic acid. It's very important because of their low hemoglobin, you need that one so that the hemoglobin will be a bit high. This is number one. Number two, advice for them, I advise them to make sure they have the prophylaxis against malaria because the infections are one of the predisposing factors for sickling. That means the disease will be there. That's why we recommend that all sickle cell patients should have a fancida or even chloroquine. Like I prefer fancida because you give it only monthly. Then every month they have to take that tablet so that it prevent the occurrence of malaria. Another thing for sickle cell patients less than 5 years, usually because of the low immunity, because the spleen is not functioning well, or it was lectomy, we prefer to give them penicillin V, which is very important because we know because of the splenectomy, that means the spleen will not be there, will be prone for infection. That's why we give them that. They have to give it regularly on daily basis. Another thing, very important, they have to make sure that they receive all the vaccine, especially against pneumococcal vaccine, very important, even influenza. All the vaccines are very important so that they prevent themselves from getting infections. Then regarding recommendations, especially for regarding recommendation for sickle cell, I think I recommend, if possible, for our government in South Sudan, let them just at least provide some basic things for, not sickle for all the patients. Yeah, you know, our hospitals are not well equipped. We're lacking so many things. I think it will be better if they can just do something regarding that, especially oxygen, especially the blood supposed to be there, so that we can just save this patient, because this patient will be in need for blood, need for other things. And then if possible, nowadays we have this hydroxyurea is very effective in the reducing of painful episodes, and also very important for reducing the acute chest syndrome, and then from the need for blood transfusion, and also some studies say there's also prevent occurrence of stroke. I think this drug, we consider it as a magic drug, especially for sickle, especially if you are taking them on a regular basis. I would recommend, if possible, also they can just provide it for free because it's a bit expensive. I don't know the price of it, but it's very important. Most of the patients, they tell you that they cannot afford buying it. If the government or any other entity can just provide this medicine for sickle, I think they will live like normal persons. Because when they start taking this hydroxyurea, the symptoms will not be there, the hemoglobin will be normal, and then the most important thing will prevent the occurrence of stroke. That means they will not be dependent on others. Because sometimes you find that they are living very miserable life, especially if they have a stroke. Because they need somebody to just take care of them. This is very bad. But if they start taking it on a regular basis, continuously, they'll not be having any problem. I think that's just what I can just say in brief.
Thank you so much, Dr. Joseph. As the one of the only pediatric hemato-oncologists who will soon graduate, I think you will be at the forefront of advocacy towards providing better care for individuals with sickle cell anemia and other hematological disorders. And we will join you in that fight and advocate for free medication, especially as you indicated, hydroxyurea, which is quite expensive and not affordable for many people, which is something Suzanne has also mentioned. And that is something that our government and the Ministry of Health have to think very, very seriously about making care accessible and making the drugs accessible, so that individuals who are affected do not suffer severe consequences of the illness. So before you go, you just give us a concluding statement, but let us first hear from Suzanne, who will give us a personal perspective of what she thinks should change when it comes to the perception, views, and treatment of those with sickle cell anemia. So Dr. Joseph, just hang on a bit. You just give a concluding statement in a minute. Suzanne?
Yes, I think that the only option is that when you're treated with sickle cell anemia, as the doctor mentioned, most people think sickle cell anemia is a curse. It is not a curse. Sickle cell anemia is not witchcraft. So people with sickle cell anemia, I think they should be treated the same way other people are being treated. They shouldn't be treated indifferently just because they have crisis and they are not like other kids. They're just normal. I say normal in a special way. And also about the treatment, I think, as doctors say, that the healthcare should provide at least cheaper drugs, or rather the government should minimize the taxes put on the drugs for the common man out there to afford the drugs. And also more awareness should be created to eradicate those common myths on sickle cell anemia. And also that as a person with sickle cell anemia, I think I am ready to advocate. I say I advocate for sickle cell anemia. I started that. I visit hospitals. I see kids with sickle cell anemia. Most of my birthdays, I celebrate with them. And also, I create awareness, which I personally would like to take that to South Sudan. That in that, to take in that, I need support, both financially and also socially, psychologically. We need that support, and also from our parents. To me, I can say I'm grateful to my family, but there are children out there who are not getting that love. Person with sickle cell anemia needs love. They are not indifferent. Do not, when the doctor gives you drug, do not take your child to a witch doctor or give them herbs that it will cure sickle cell anemia. Kindly do not mix medication that's given by a physician with herbs. Most people advised my mom that it is a curse that I should be given herbs. But the reality is sickle cell is just a disease that can be treated in hospitals, and it can be controlled, and the crisis can be minimized. So let's say by creating more awareness through our social media, the radio stations, the TV stations. I think abroad they have those World Sickle Cell Day Anemia. Every 19th of June, they do celebrate. They are going to celebrate actually this year on 19th. The other year we celebrated on the 9th of June. So I think really it should be done the same in Africa. People should know about sickle cell. When you enter the hospital, at least you have something written there, the way they write about tuberculosis, cancers, HIV, at least something written there that you should be aware, at least just a fair view of sickle cell anemia should be done in most of the hospitals to create awareness. Most people would like to know. Most children are suffering there with it, in the villages out there, everywhere. So I think that we need really more awareness. We need more campaign on this disease. That's all I can say. And so thank you very much for that.
Thank you so much, Suzanne, and thank you for actually saying that you have taken it upon yourself to also create awareness, to be a champion for information on sickle cell disease. And I think it's very, very important for people who are affected to hear from someone who is speaking from a personal perspective and from personal experience. And that is what now becomes the bridge between us as medical and healthcare professionals and those who are affected. If there's someone who stands in the gap, who is able to understand what the process is, what the treatment is, what the progression is, and is able to explain that to someone else who is suffering and even give them courage and hope. That is very important. So we will get a concluding statement from Dr. Joseph. Dr. Joseph, if you just give us a concluding statement before we wind up.
Okay, thank you very much, Dr. Anne. I think I have like 4 or 5 messages to. Number one message is for the general public. I think I'm going to say the same what your
Suzanne? Suzanne.
Suzanne. It's called Suzanne.
Yes, Suzanne Juma.
Yeah.
Yes.
Yeah, Suzanne Juma. I think sickle cell anemia is just a disease like any other disease. People have to be aware about that. Sickle cell like malaria, like anything. Just you have to eradicate that misbelief that sickle cell is a curse or something like that. This is very important for general public. Number two, message is for the youth. Those who are planning to get married. It's very important for them to just know their status, whether they are carriers or there's something like that. Because if you know your status, and then you know the status of your girlfriend or boyfriend is very important. Because if both of you are carriers, so that you know that there's a possibility of having kids with sickle cell anemia, and then you can now just decide whether you can just go ahead or if you find another. This is very important. I think for us as health professionals, it's very important to just carry on with this kind of awareness. It's very important because people should know about the sickle cell anemia, how it's treated, and all these things. And then for the government, I think it's very important to just provide these patients with some basic things, so that we can just reduce their suffering. They are really suffering. And then they have so many problems. They have social issues, they have emotional issues, they have all these things. Also, besides their illness. I think if they can just provide some things so that they can just help them, at least elevate their suffering, will be very good. And then my last message is for the parents of children with sickle cell anemia. These patients are going through difficult times. They will have pain most of the times. They will be frustrated. They have emotional issues. I think they need to support them, because without their support, they're not going to persevere with this disease. I think this is very important. And lastly, also I want to thank Dr. Anne and South Sudan National Women Forum for giving me this opportunity, so that I can just also take part in the awareness about sickle cell anemia in South Sudan. Thank you very much, Dr. Anne, for giving me this opportunity.
Thank you so much, Dr. Joseph. We are honored to have you on the platform, and I am thankful that you have decided to be the person who will go and stand in the gap for children who suffer from blood diseases and from cancers. And we will definitely be reaching out to you whenever we need either information, education, or even we need to refer children with blood issues and cancers to you. And thank you so much for joining us and for being able to tell us a little more about the medical aspects of sickle cell anemia, and also for emphasizing the need for reduction of stigma, the need for education of the public and the individuals who are affected, and the need for genetic counseling, which you have also been able to emphasize, and for even speaking out to those who are making the decisions in our government and in our Ministry of Health to ensure that these services are provided either at no cost or at a reduced cost to ensure that there is access. Thank you so much, Dr. Joseph. So as we come to the end of the session, I'd also thank you, Dr. Joseph. I'd also like to thank Ms. Suzanne Juma. Thank you so much for your courage, for standing in the gap for those who have gone through the same thing as you, for being the one that they can look up to and have hope, because now you have dispelled one myth that has been there for a very long time, that children who have sickle cell disease don't live past the age of 18. And you are 28 years, and I can see you're still standing strong, and you have even taken it upon yourself to have the mantle of informing and educating the public on sickle cell and advocating for provision of services that are affordable to people who suffer from sickle cell disease. So I would like to thank Suzanne and Dr. Joseph for joining us today for this discussion. And I'd also like to thank the audience for joining us. Thank you for listening in. If you have any questions, please feel free to ask on our comment session, and Susan and also Dr. Joseph will be able to answer when they get time. So thank you, Susan, for joining us. Thank you so much. I am very, very encouraged by you being here and by you being a beacon of hope and a testimony for people who have sickle cell disease. And thank you so much, Dr. Joseph, for taking care of our children who have sickle cell anemia and for being here to give the public information on sickle cell disease. Thank you so much, and until next time, we hope to see you again. We hope to see you again. Bye-bye. Thank you, Susan. Bye. Thank you, Dr. Joseph. Bye.
Thank you.